My name's Michael Pollington. I'm the Data Protection Officer and Information Governance Lead. I'm also the Corporate Governance Manager. So it's quite a varied remit, everything from risk, compliance, audits, obviously data protection. It covers information security and things like that as well. And part of my remit is radar, of course, which I was handed when I first started here, which would be 3.5 years ago now. So yeah, it's been an interesting journey for me because originally I was in the NHS. So I was in the NHS for nearly 20 years. I didn't quite make the 20 years, which did irritate me. But even though I was in there for nearly 20 years, it was time for a bit of a change. So I still wanted to do something worthwhile, and the hospice came up, and basically the remit was, we need help with things. They were kind of rebuilding after a long time of obviously COVID being there and everything like that. So I basically come in to build up the governance side of things, and radar was already here, just wasn't utilised yet. So I was ecstatic. Datix was kind of the main system. Everywhere I'd been before that was always Datix. Before that here was spreadsheets and paper forms basically. So it wasn't massively well managed at the time. It was kind of capturing most of the stuff was from the ward alone. It wasn't much else, unless there was a severe incident. So it wasn't very well controlled at the time. So having a radar compliance system already here to be used was a bit of a godsend for me. Because other places, that's what I wanted us to go away from the traditional NHS Datix sort of model to something different. So. Well, it was more that we'd seen for many years. I attended a lot of the expos in London around technology, and technology had rapidly changed over the years. It was a lot more user-friendly, was a lot more focused on how the user could use it in a straightforward way. I'd like to say more internet-based, because you looked at the format and it was quite simple to follow. Unfortunately, the way that Datix have gone over the years was they'd kept quite a old-fashioned format to it, and it still looked quite technical. It wasn't overly user-friendly, and a lot of people didn't overly like using it. So when you look at a lot of the other ones that were coming out, including radar, instant reaction, you go, oh, this is very user-friendly. It's a lot more kind of an internet-based form. It looks brighter, and you can use it anywhere. There's no installation needed. So all that stuff normally you need technical people for was gone. So for me, coming here and already having that compliance system, it was excellent, because I knew there could be a central place for everything, and we wouldn't have to have it all separated out and need a guru to know how to even use the thing. So when I first came in, the very first thing I noticed was the figures that were given out for incidents were quite low. And thinking of the size of this organisation, comparing it to previous organisations I've worked in, the amount of incidents didn't quite add up. So that figure, it sounds odd to me to say this, but I wanted more incidents to be recorded, because the likelihood is we had more incidents occurring than actually we were recording. So for me, that was a given. We're starting there. So set up the incident side of things, got it up and running, got some buy-in, non-stop communication, to the point I think it must have irritated people, but the idea is the more comms the better. So once the system was ready and we started communicating it, it was then kind of meeting with key people in clinical, because I knew that's where a lot of the incidents were going to come from. And then it was actually, again, a bit more comms. If you've noticed, I've mentioned comms a lot because that's what's needed. The more comms we did, the more people started saying, I better radar that, I've got to put that on radar. So radar become a common phrase. Before that, people didn't really associate incidents with radar. Once they'd got to that stage, that took a good 6 months, and then we launched it. And pretty much as soon as we launched it, we saw the incidents increase. And then over the space of a year, there was lots of tweaking going on, changing bits and pieces, making things a bit better, and then regularly meeting and sort of saying, well, we need to get this data out of the system, can we do it? And slowly people learned that actually, yeah, radar's the best system to use to get the data. And then they wanted to learn more, so they started doing reports on it. And while this was happening with clinical, I was looking at centralising policy. So that meant that led quite nicely on to using the document side of things in Radar. So then all policy that was pretty sporadic and not managed that well was then put into Radar. Everything I found was put into one place. Even if it was only part of a policy, I'm like, no, we're recording that. Names were put against them, where they are, where they worked. A new template was introduced to go into Radar, which meant then people could have quite a standardised approach to that as well. So it meant we had then the incidents going on, but also the document side of it, and they run side by side quite well for a good year and a half, 2 years. And all along that way, I don't think, I can honestly say we didn't stop tweaking the whole time. And that led on to absolutely loads of other stuff we then started doing with events. A big thing for me, obviously, being data protection officer, there's loads of things we have to do in evidence around compliance. And data protection impact assessments aren't the easiest thing to complete and do. They're very kind of paper bulky and drawn out, but everybody's are quite similar. So what we ended up doing was creating a form within Radar that was the same as the ICO's version of a DPIA. Once that was in Radar, we then built up the workflow of what that was. So initially it would be the person would log the call, fill out the initial questions. That would say, yes, you need to do a full DPIA. That would then be completed. Once that was completed, it would automatically then notify me as DPO that this has been completed and needs assessment. I'd check it, and I'd then be able to say whether the particular things need to be paid attention to, whether you need more advice, whether it's legal, things like that. Once I'd approved it, it would then go to the CIRO or the Senior Information Risk Owner, and then they would kind of add final approval if they need to, for if there's any high risks on there need accepting, which normally there's not anything high risk wise that they need to accept, but it's still there for them to have almost like an oversight of what's going on. So that's where I think Radar for me earns its money, because you're not just getting a paper form and saying, okay, this is now on a system, because technically you can do that with anything and it can be done. For me, it's actually the automation part. So the fact that somebody's completed a DPIA, I've not done anything at that stage, but then I'm notified that it's been done, and now I can do a bit and authorise it. But then I can take my hands off again. It's almost like it's actually that whole process of automation that makes it a good system. It's not that you've done a form and it's now Paperlike, because to be honest, you can do that now. But once it's in the system, it's there, and we don't have to worry about it. It then almost takes care of itself of what it's doing, and you just tweak it, make it a bit better. And we did the same thing for legitimate interest assessments. We put our Caldecott log on there. We did a few things for clinical that needs to be on there. We did logs for CCTV through it as well. So if CCTV needs to be used, whereas before there used to be a paper form that used to be approved in triplicate by various people and things like that, we went the other way, which I approved as DPO, which was if you need to use it, you can use it, but if you go on the form, it will tell you the reasons you can use it, and you have to declare what you've done. And then I get an email pinged across to me that says this has been put on Radar, and I can check it, and I just leave a note on there saying, yeah, it was checked by me and this was a legal reason for checking the CCTV. So it's not the fact it helps you to go Paperlike. That's not the key bit. The key bit is it helps you to automate what you're doing, and in the process people go to one central location to do the things that you're doing. So there's one list, incidents, DPIAs, Caldecott log, you've got that one list there. You just pick what you need to do, and the process is up and running. No guidance needed, because the system does it for you. It's almost like the invisible safety system. So there's stuff happening in the background that's done that includes things like incidents that are then reported on, that then go into the safety huddles, that then inform our clinical director of what's happening, our head of quality and clinical, she gets to know what's happening as well, and then the sister of the ward, Natasha, gets to know what's happening. It's almost like before it was very sporadic, so things were happening but you didn't necessarily know the ins and outs. Now you get that information and it brings it all into one place, the regular reporting on it. You can check on the key things you have to check on, like the ulcers, the falls, and things like that. But at the same time, you can also check on other stuff. So you know the trends that are coming out, you know if there's a lot of medication incidents. And all of that has led to, especially on the ward, having extra learning that didn't exist before. So, and even though all that's happening in the background, the reason that it makes it absolutely perfect is because the patients have no idea it's happening. So it's not something where we're having to do extra questionnaires with the patients. We're not having to ask for that feedback on things. Don't get me wrong, we still ask that, but there's lots of stuff already happening that means that will feed into safety elements of what we do. Without that there, I can't imagine how the lessons learned were actually carried out. Whereas Natasha embraced it pretty quickly and went, I want to now put an A4 page on the wall that says the lessons we've learnt this week or this month. And then she made all of the nursing staff aware of it, all the HCAs and people like that aware of it. So just from a system collecting data, she's then got lessons learnt and other people are learning from it, which then affects how they treat patients on the ward. I think seeing those benefits all the time is amazing, because you regularly see it every month. Things have changed again. And the fact that she's able to do it in a way that doesn't say, this is now paper-light, I must only do it on radar. She's thought outside of that and gone, no, I've done that, but how am I actually going to get the message across? So then it's instantly, yeah, it's on radar, but actually I'm going to put it on this poster, or I'm going to bring it into the huddle, or I'm going to do this bit extra, or I'm just going to talk about it over lunch, or whatever it may be. So I've noticed that a lot of people have an expectation with systems that now you're doing it on there, you can forget about it. But what's key to it, or been key to it here, has been, yes, they've used the system, yes, they've got the data, and they've got these great things that it will tell you in meetings, but then they've taken it one step further and they've said, actually, how are we going to make this practically work? How are we going to actually have an impact on the patients at the end? And it does have such an impact on the patients, but the patients have no idea. And that's what I think a good system is. A good system means you can use it, you get benefits from it, but the patients don't necessarily know. If you come in and said the patients were very aware of the compliance system, what it does, how it does it and everything, I'll be questioning, well, why? And is there a reason for that? Is it because the nurses haven't got time to spend with the patients? Where in truth, you want it to be pretty invisible when they come in. So I don't know if that's a good or bad thing for radar really, but for us it's good. But it's massive in a way that, you know, when you utilised other systems in the past, you knew you were kind of doing tick box exercises. It was kind of, you were doing things because you had to do it, because you were told to do it, and that's kind of why it was there. The radar and compliance is a bit more along the lines of, we're doing things because we can see the benefit at the end of why we're doing it. We can do it in a way that it's user friendly, it can be adaptable. And for me, being very selfish, that's great for compliance, because the more you can make things simple to use and straightforward, the less you have people not doing it, basically. So if you can go in and you can raise your incident, and once you've raised your incident, the automation kicks in and does everything for you in that way. For me, compliance-wise, that's great, because now that's happened in the background. Nobody's had to count things, nobody's had to do an audit in a different way. I don't want to imagine this, but if radar wasn't there and we didn't utilise it in that way, compliance-wise and keeping evidence of things would be quite a nightmare. Even just using a different system, a lot of systems I've seen that have been demonstrated are quite heavy on IT. So you kind of need quite knowledgeable, I'll use the word gurus again, to be able to come in and, you know, have the nerdy people who come in and go, yeah, we're going to do this, we're going to do that. What do you want it to do? Oh, it needs to do it. Okay, we'll go away and build that and we'll come back to you. With radar, you can actually just sit with a clinician and work on it. So that means any compliance that does come up, any regulations that do change, it's so quick to get it changed. It's insane. Even we found a minor thing, that something on a particular form we had wasn't quite right. Natasha would contact me and say, this is the report we were hoping to get on this particular thing, but I've noticed this on the form. We'd talk it through, find the best way of doing it and change it. And I've not had that anywhere else before. And it is purely because it is that that user-friendly. And with data protection, we utilise the enhanced audits. It's a massive audit, the one for the data protection officer audit for the year, because it's looking at the whole organisation and are we meeting certain things that the ICO want us to meet. So with that particular audit, absolutely pages of it, but I can now go through, do that audit, and I won't do a overall typed out Word document or anything like that. I just use the standard PDF format that comes out that says what has been done and what hasn't. The only extra part I add is the stats, if you like, to a certain extent. So how well we've done this year compared to last year. Have we improved a bit? Are we in the green? Or have we gone down to amber in certain areas and things like that? And are we now meeting new regulations that have come out since then, or new advice that's come out? So it's compliance-wise. Again, before when I did DPO reports, they used to take a long time, and I used to spend more time, I think, creating the report than I did actually investigating or checking things. Now it's switched the other way, so I spend most of my time just looking at, are we meeting things, rather than spending my time creating a nice pretty report with graphs on it. So thankfully Radar does that for me. And it's no different. CSIRO reports as well are the same. Senior information risk owner needs to know that certain things are being done, do it all on the system. It comes out at the end how well we've done the report. Hopefully in the future we'll be moving across to a lot more of the clinical side of things as well with reporting, and that again will just increase our compliance that bit more, so we can actually see a lot more on the ward, things like hand hygiene, checking how certain things are done, the visual side of things, so are people performing things in certain ways, and then again how improvements can be done, and then hopefully all those reports again feeding into one place will be picked up and improvements made. So compliance, the compliance element, and using the dashboard as well to see that. I regularly send out comms, again mentioning communication, but regularly send out comms on how many incidents we've had, how many things have been closed, how many are outstanding at the moment, and then I contact the heads of service and things saying, are you aware of this complaint? Are you aware of it? So it's basically at your fingertips to do it all, and the compliance side of it just follows it. Whereas other systems, it's like, to do the compliance, you've got to create it all and put all this information in. So it's almost like actually we're just creating a system that works for us, and then the compliance is coming along with it. So it's turned it on its head a little bit. It's a lot more kind of moulds to what you need it to be, and you get compliance from it, as opposed to let's focus on compliance. What I've learned, and it's a difficult one, and it's one that if anybody ever has the answers to, I'll happily listen to it, because it'll be great. It's very difficult sometimes in any organisation, depending on what the culture is and how it works, how to get buy-in from the key stakeholders that are there. I always go down the route of masses of communication, whatever I do anyway, on projects of any sort. But the key thing is, which is a lesson thankfully I already had, but was the system doesn't do everything for you. You have to tell people, be very honest, transparent and open about everything that you're doing. If you don't do that, you're going to lose the battle of bringing in a new system. We thankfully here had kind of that element of they didn't have anything at the moment to compare it to. It was a positive and negative. So the positive was, ooh, shiny system. The negative was, oh, I've got to use this instead of paper now. So you have the two different sides to it that came about. So learning for me would be, more than anything, is make sure you've got a team to do it. So for me it was kind of a bit of a one-man army that was kind of driving it to get out there, whereas it had been much better if I'd have had clinical a lot more on board, the income generation side of it on board as well, so they could all drive it with me. Don't get me wrong, it worked well and we did get it out there, but it tended to be a lot of it was me kind of driving it and then going to talk to different people to get things done when I needed it done, all around the hospice. So it worked. But I would say to anybody, the biggest thing is comms and getting your stakeholders right at the start to agree to help you on the way. So not necessarily to be always there doing radar, but to be there with you to push what you need pushed. I was just quite lucky here, I think, with the hospice is great, so they're really open to new things and to working on different things. So I think me coming along and then saying we're doing this now, they were quite open to that. So I was very, very lucky in that way. But I'd also say that if you're going to roll out a compliance system, is try not to think about the compliance all the time, because ultimately there's a patient at the end of it, and there's clients at the end of it, there's children at the end of it. You don't want to make it to such an extent that you're so focused on compliance that you forget actually the main amount of the time has to be spent on them, because that's what we're here for. So yes, you've got compliance, but if you can build the system around how it's going to help that clinician or the HCA or the therapist to use it in what they do day to day, the compliance will follow. There's no good putting a system in place and then expecting suddenly time to appear and everything to be great. Just focus on what actually you need. How's it going to help? How's it going to improve things? Compliance will follow after that, and you can add things after that if you really need to. My experience here is if you focus on actually just improving how you work, you then go, oh, this compliance we have, it's great, it's just at our fingertips. So it's not always just about focusing on we must meet these things. It's also about, is it going to work? Is it going to work for them? And look at how they work now is another one. 9 times out of 10, when you look at how they work, there's already a lot of things they don't necessarily need to do anymore, because you just get into that everyday slog of doing the same thing. If you manage to, when you're bringing in any system, manage to look at how they work now and already find that there's 2 or 3 things they don't need to be doing, and then you get 2 or 3 more things in the system they don't need to be doing, all of a sudden it feels easier. And that's with any process. That's even not with the system. If you just look at processes, you can do that. But with a system coming in, it's even better because you can add even more. So value to having that system in place. It said value for money, but it is value for money. But it's that value you get out of it, having a much more streamlined process in place as well. Yeah, so I've seen. I feel like I've seen lots of systems, and locally to us, Sentinel is another one that's about as well. And I've seen a demonstration of Vantage and things like that as well. And it sounds really weird, but every single system at the heart of it does the same thing. But it's what they actually, how they work and what they look like and the feel of them that makes the difference. So for me, I found that other systems felt too complex, and that might be my simple mind, but for me I want something that's very straightforward, and at the same time as it being straightforward, it can collect the complex stuff you want it to. I found Radar did do that, whereas I found looking at other systems, they were still very reliant on key people knowing the system in and out and being quite IT literate to be able to do things on it, and that to me was something that put me off those other systems like that. So yeah, I don't feel necessarily that I'd ever go, oh yeah, let's go and look at this system because it's all shiny and lovely. IT would, don't get me wrong, because IT likes shiny, but you don't really want IT to lead a project when it comes to a system, because they will be able to use it beautifully and will make it look very nice and shiny, and it will be great. But the end user isn't an IT professional. They're not people who spend every day with the system. So ultimately you want them to be the people buying into it. And also we found when it comes to value for money, when it comes to Radar, I did find that a lot of the organisations do things in modules, and it's all built up a lot on kind of how many modules you take, this many users, that many of this, you do that, and before the end of it you're spending a lot of money to do something, and in the NHS that's normal. You expect to pay out thousands and thousands of pounds. I found with Radar the value for money was much better. So, we would technically have to double or even triple what we're spending now to get a different system, and to a hospice that means the world. So that money that normally we would be spending on that could be an extra nurse, extra community nurse, extra therapist. So I personally couldn't justify that. And the fact that all updates are done by Radar, there's no kind of you need this update now. The innovation that comes out, like with the LFPSE, which we kind of, I think we embraced when I kind of pushed it forward a bit, but we embraced it and we've gone, yeah, we'll go ahead and do that, be one of the first hospices to do it, purely because we'll have to do it eventually anyway. But the fact that it automatically then communicates with the NHS and submits our data for us, what a win. And it's not been a case of we've bought out this new thing, but you're going to need to pay us X to get it. It's been part of a normal update. And that's, to me, sums up Radar. They're not out to just make tons of money. They're actually out to almost have that, I suppose the way of putting it is they want to be what they are. And the way that they've fit in the market for me is that they're not like the other companies. It's nice being able to talk to somebody and actually have faces rather than just you go into a big long list of people that you're going to talk to. And it's nice to, if there are any issues, just be able to log a call, talk to somebody, sometimes even recognise the person you're talking to, get feedback, get what you need. If they don't know, they'll know somebody that does. And the fact I've been on calls with the person who's basically the highest in the organisation, and that's relatively unheard of in a lot of the compliance market. I'd actually been on quite a few meetings with him, so it just doesn't happen. So it's that, the fact that the delivery of that product from Radar is very, very different to others, and it is very, very focused on the customer, not just on we want to be a massive company and making lots of money. It's like, well, actually we want to deliver a system that's good and that people can use, and that's what I feel like they've stayed. So when back in, was it 3.5 years ago when I joined, I felt like Radar was like quite small, it was about 40-ish staff, I think, and now obviously it's doubled at least since then. But it doesn't feel any different to what it did back when I first started getting support from Radar, which is impressive. But most places suddenly get really big, and then you suddenly get the generic people on the phone, and you don't get the help that you used to have from people, which is really sad. So Radar, in that way, as it impresses in the way that it's actually user friendly. It's actually has a face. It has people in it. Has employees. It actually has people there, and that to me partners well with the hospice, because everybody here wouldn't be here if they didn't believe in what they were doing. Trust me, you don't come here for the money. So you come here because you believe in what you're doing. I'm here to support clinical staff. That's what I'm here for. I know I'm not the frontline people, but all the people that are here in the background are all here to support those staff, and Radar's part of it. If we didn't have it, it would take us a very, very long time. There's two parts to that. One of them is that where I hope it's going, and where it might go. So there's part of me that's the realistic head, and there's the other part of me that says it's going everywhere now. But no, I think as always there'll always be a system of choice for people to have. So GP contracts, there's a system of choice. So and I think it's similar really. Everybody likes different things of what they'll go with. I see Radar growing an awful lot, because you see it every week. Something comes out of what they're doing, the new innovations they put in, but also the new places taking it on. So for me, I'd love it to be that a lot more places took on Radar, and as it goes forward, there's more and more innovation, more communication between different things, different abilities, and I do honestly think that Radar are the ones to do that, because they're constantly doing stuff to do that. I don't see that as much with other providers. A lot of other providers have gone down the route of what I like to call AI washing, which is a common phrase now, which is they mention AI and stuff they're doing with AI, and it's all about AI and it's going to revolutionise the world and everything like that. Radar haven't done that. They've focused on what things are there to improve what they're doing. AI might be part of that, but it's not the be-all and end-all. So I do feel that it probably will spread, and we've got, like I said, West Suffolk Hospital and us, they're on it here. I know the other hospices here use something different, but you never know what's going to happen in the future and how it's going to change. I do honestly hope more people go on it, I can't see why they wouldn't. Actually, so I'm quite biased, but I don't see why they wouldn't. Because personally, if I walked in somewhere, I'd rather be using radar than the other systems that are out there. And it saves time. It's no faffing about, and they get all that support from radar. You don't necessarily get that from other places. They card you extra for just about everything. So yeah, I hope radar continue to grow and stay with their mindset of being there for customers. Events is a massive thing. Events has been I think the key bit of everything we do now. So what we hear a lot in meetings, before it was always me driving a lot with we could do that in radar healthcare all the time, but actually now it's turned into Michael, could we use radar healthcare to do this? So they're always constantly looking for ways that actually they can use the system more. And that originally was just the clinical teams, but now it's actually moved into the realm of the income generation teams are now starting to see, could we use it? Is this a different way we could do things? So before it was always the same. We're going to do a Word document, we're going to do a form, we're going to put it on a shared drive and nobody's going to see it again or something to that effect. We're going to have to count stuff and everything. Now a lot more they're seeing the benefits of it. So events is just amazing. Documents I love because I don't have to think about things, put stuff in it, and then reminders go. It reminds the right people, tells them what's happening, and I can just see straight away what's in date, what's out of date, what do I need to chase about and what I don't, which is just excellent. I'm looking forward to using audits more because I've been using it a lot for what I do as a data protection officer, but as clinical side of things, I think that's going to really be a game changer for them, and will really, really change the way they see things. And risks, I'd say dabbling, but for me it's a case of I've put all the risks of the organisation into one place, but now we're getting through to the directors and people like that seeing, actually we've got these in one place now, we need to start using it in a better way. So it's improved the way that they can keep an eye on risks in one place, keep them up to date and make sure somebody's dealing with them. So I think, again, me being biased, but all of radar healthcare does everything you need it to do, and whenever I've had a moment of I wonder if we could do this, I've always been able to make that call and then somebody to say yes you can, and I say yes you can because 9 times out of 10 it is a yes. It's just I wasn't sure how to do it. When I was asked to do it, I was ecstatic because anything that involves hospices communicating is good. But what it's actually led to, incredibly, is so much engagement from the other hospices. It's been brilliant. So obviously we all sing off the same hymn sheet. We all do the same similar sort of things, but actually we're all so different in what we do. I'm on there as a DPO compliancy person, and then you've got somebody else on that same call who is actually the clinical lead, and then you've got somebody else on the call who's actually in IT. And so hospices have to be really dynamic with how they work, and you won't necessarily have a specific person that's called radar healthcare systems manager. It'll always be kind of a job within other jobs. So when we get on those calls, everything comes up from, has anybody seen this before? Do you know how to do things? The clinicians that go on it are brilliant because they just throw spanners in the work that we'd never heard of before, and everybody sits there and goes, hang on a minute, we've got a solution to that, which is great. And then Daniel on the call from Radar Healthcare, he always comes up with really cool things like one of the hospitals shared their audits and sent it out to all of us so we could pick and choose what we may be able to utilise as well. So it's that sharing knowledge that you get from it, and it's not an easy thing to do all the time, but having that group, and it's not a massive group, but we have found it's grown a bit. I think as people have seen actually it's a big benefit, and to the other ones they've now gone, oh, I think I'll go along to that, and now we've got a few more people from each of those organisations coming along as well. So the benefits we get out of it are just learning knowledge from each other, coming up with things, demonstrations. We get different people to come along to demo bits and pieces as well, and yeah, we get stuff from it all the time. So whenever one of those is held, I always look forward to it because of the latest kind of thing that needs solving, that somebody else will have a solution. And the thing I always made clear as well, and I said to Radar Healthcare, was you don't have to, even though it's called Radar Healthcare, I think it's really important they realise that actually the system is so adaptable that it adapts to tons of stuff. So for lack of a better example, audits in shops being utilised, forms for income generation, events and things like that, the audits around cleaning, anything you can think of that normally you would utilise in a healthcare setting fits perfect right across the hospice. It can be anybody, any team that's working here. And we've found on that call, we've got people that are using it for their audits in shops. And we've got people on there where they've got a form that's used by their retail side of things. And sometimes that's not always thought of with certain systems because they're very focused on a particular part of the market, which is just health. And that's all they'll look at. Whereas Radar, it's so adaptable, it can go with anything. So it's quite funny because the one of the main ones on there, it's really good. She comes along and she listens lots because I think the main benefit she gets out of it is they're quite new to Radar Healthcare, so they don't necessarily see the all of the stuff it does at the moment. So she comes along, she's in the meeting, we come up with all these different things. She must sometimes go away and have a headache, but she hears all these different things that she gets from it, and then she's able to apply that where she is. So she knows things are already happening before she knows it's possible, which is something to a certain extent. I thought, I wish I'd have had that, because it would have been great to already almost be in that group and then hear those things coming back. I think we have an advantage though as well in the size of the group, in that, if you went to say the NHS side of the group, I imagine it's quite massive compared to the little hospice group, but that's our advantage to a certain extent, because with a little hospice group we can come up with lots of ideas, concepts and push things forward quite quickly, and get other people involved with it quite quickly, whereas I can't imagine it's as easy with the bigger groups. So yeah, it's fascinating. I'm hoping we'll hear the journey of the American hospices as well a bit more as we go forward, to hear how they're coping with things and how it's different. And we actually have a American lady that works for us that worked in American hospices before coming here, so it's quite interesting as well, because we kind of get some insight from her point of view of what it's like over there in the American hospices as well. So it's quite interesting hearing different points. You need to get some hospices in other areas now. I'm thinking Germany, France, some places like that would be good. So that's your task. Yeah, no, it's not been anything negative really. It's been, I've found that everybody on the group actually has been, what I'd expect from hospices. It sounds really weird, but I used to be on a lot of obviously the big groups when it comes to NHS and things like that, and obviously chairing the Information Governance Steering Group for the ICB is lots of organisations across the area, so that's Suffolk and North East Essex. So that'll obviously include other hospitals and things like that, hospices and things. So you imagine, if you like, that tons of different personalities, but very NHS minded. You also have a different mindset for hospice care, and there's a slightly different mindset for social care, and then so everybody has a slightly different quirks to different things. But with hospices, generally it's just a bunch of nice people. That's the only way of putting it. I like to say that I don't at all, because I prefer to hear what other people are saying. So for me, if they're utilising it and I can see that obviously incidents are going on, things like that, for me, I'm quite easy to satisfy. That's looking good, the things are happening, technically wise it's there. But for me, it's the fact that when other people mention it, say what they want to do on it, how they want to utilise it further, start asking questions about what it can do, ask for more training, anything like that, that to me is the success of Radar. I don't really like the what I like to call the happy sheets. do you like this system? And then they have to tick yes every time because they know they're handing it back to you. I prefer the method of just naturally, are people utilising the system? If you can see that trend going up of an increase in certain things happening, there's more documents on the system, that's an easy way to see it's being used, but that doesn't necessarily mean that people like it. So it's much better to hear from actual end users what they're doing, and clinical staff. They're always, my benchmark is always, are clinical staff happy with what they're doing and how they're doing it? If they are, then to me that's a win, because it means it's not massively impacting what they do. It's that invisible system thing again. If they're able to do it and it's not massively impacting how they work, then we've won. The biggest thing is, I think, what I mentioned earlier on about with lessons learnt then being impacted by what then the sister on the ward will then do with it to improve how her teams work. But I think another part to that is actually, sounds like a negative, but it is a positive, which is locating things you didn't know were happening. So a big thing is, for example, you may go on the system and they might find all these ulcers have been logged as incidents on here, but they were only logged at a certain category. And now they've realised 6 months later that they were incorrectly logged because that category is incorrect. I looked at that as a positive because I went, but you wouldn't have known if we'd have done it on paper previously. So it's that thing of it completely keeps things transparent. So you can't hide things away. It's very much, not that people would, but it's more of because it's so transparent, you'll be running reports, looking at things and then going, hang on a minute, that doesn't quite look right. That to me is great. That means then we can learn from what that was, change it, make adaptations, deliver staff to train it, the training they need. If we didn't do it in that way, we'd never have known. So to me, the fact that it's there and it's very clear that it's somewhere like that, it's a massive benefit. It does definitely help them learn all the time. Like I said, it is the clinical stuff. I try not to talk about my stuff too much because I feel a bit like I cheat now at work, which is, I think, can I use Radar Healthcare for that? And then it makes my life easier. So I try to mention clinical stuff more. But yeah, they're definitely getting masses of benefits out of it. My favourite feature on Radar Healthcare is the ability to do the audits that I can then do my reports, because it saves me so much time. I can set up an audit, carry out the audit, and then it's their PDF and I can present it. So much easier. It saves so much time, and it literally is hours and hours of time compared to what it was before. The sooner I get clinical to utilise that, it's going to be so much better. And it'll bring in that extra safety element that I'm looking forward to as well. So you'll have all that data there that you've captured, but also that evidence that you're doing the hand wash checks, you're doing the other nurses doing certain things, they meet in certain obligations, and will help with their things like when they re-register with the NMC or the doctors do their GMC stuff. We've kind of got extra evidence there for them as well then. So they've done an observation of this doctor doing such and such procedure and got the evidence. So that to me is it's worth everything, because it will have a big effect on them. They never leave me alone. No, just kidding. No, it's, the key bit from it is that we get, obviously, the normal updates we get from Radar anyway that tell us what's going on. And I absolutely love the online section you get to in help and stuff, where you can go to new ideas being proposed, you can vote on new ideas and everything like that and see what's going on, because it just sees how it's progressing, when things are happening. And then the webinars as well are really good, so you can go along and see obviously Radar Healthcare talking about what their plans are for the future, so you get a nice little timeline when things are happening, what's coming up next, which is really nice as well. And it can kind of then helps me to promote it here, because I can then go back and say this is what's changing in the future, and everybody gets to hear about it. We don't get that with things like our clinical system and things like that as much. It's quite closed off, whereas Radar are very open about what they're doing. So again, it's that transparency, I guess. So terrible. No, just kidding. Sorry. No, Dan's really good. Yeah, no, it's great. It's always good to have actually an approachable person on the phone or on a video link or whatever you've got there, to just contact and say, I don't know what I'm doing, or can you help me with this, or can you tell me how we'd do something, and someone just always being there. And we've always had an account manager, which sometimes you don't know who your account manager is with some systems, or even if you have one. We don't have that problem with Radar Healthcare. We always have an account manager there, and are always on the phone, which is excellent. So I think actually it's fair to say that without it I'd be in trouble, because my team is massive. It's one person, so I've got to cover obviously information governance, I've got to cover the data protection obligations with that, and the corporate governance side of it. So if basically I didn't have the ability to utilise Radar to streamline everything that I do, I couldn't deliver support to people. So a lack of a better example is if you remove policy from Radar and you just had that physical policy, or you even had it just on an Excel spreadsheet in front of you, you've got to chase that up. You've got to go and see the people. You've got to constantly check on the Excel spreadsheet, make sure the dates are there, who's doing it, has that person left now? You're doing all this stuff all the time, and that's what your time's used up on. Using Radar, the document's in there, it's got the date on there, it's all been approved, ready to go, it's got the person that owns it. All the reminders are now done, so that's one lot of time freed up. It's got the owner on there that you can also instantly change when the person leaves, because then you can do the mass batch changing. So that's another bit of time I've saved. You've then got because the reminders are constantly going out, it means I can just look at one screen and say, are any of these need a bit more chasing? That's another bit of time saved. So actually, by a lot of the stuff I do in governance being on Radar Healthcare, I can actually save tons of time. So actually, if I didn't have it, I think my job would be so much worse. I'm able to spend time doing what I'm here to do, which is advise. So I can sit down with somebody, advising them about a policy or a procedure. I can go and see people about a DPIA they're doing. I can advise them on different parts of governance, whether it's around risk or incidents. I think if you took away the Radar element, the Radar Healthcare element, you'd then lose time. Basically, my time would be gone, and I'd be spending most of the time being a very expensive administrator, I think. So I guess in a way, Radar's saved money, because otherwise I probably would need somebody administrative to help me do what I do. Yeah, a comment that somebody made the other day, it's always nice to get positive comments, but one of the comments was that before I started at the hospice, they didn't have a go-to person for governance, for data protection and for risk and incident, things like that. They didn't really have that, so they kind of had to try and figure things out for themselves. So since I've been here, I've been that person. So in a roundabout way, basically, if I didn't have that ability to be the approachable person that's available, that would have had a knock-on effect that would mean basically they'd still be trying to work things out for themselves, and I wouldn't be able to deliver on what I was actually brought here to do. So yeah, no, they were appreciative of the fact that I'm here to do those things. And anywhere with a data protection officer knows that it could be one day it feels like you're not doing much to do with data protection, and the next day there's been a breach, or there's been a national problem, or legislation's changed. And if I didn't have the flexibility to be able to just do my job and advise, then the hospice wouldn't be much better off. So having it pre-set up, getting it all nicely done, radar system right at the start, means my job can be done properly. That's what I'm trying to say. So if for example, with data protection, legislation changes, or there's a problem comes in, there's a breach, anything like that with it, it can change quite quickly, and you need the DPO to be there. If we didn't have my freed up time because of Radar Healthcare, I may not be available. I may be swamped on other things. So it's key really for my role to be able to save time, so I can actually offer the advice and time for other people, and they have the confidence then to be able to do policy, to make sure they're doing the right thing legally, whenever they're doing various projects, events, or anything clinical on the ward.